Today we are going to talk about the diabetic mellitus and the eye involvement. Now, diabetic mellitus is basically divided into two groups, type 1 and type 2. In case of type 1, there is a family background is there, and it starts a bit early in the life, and it is usually insulin dependent one. And type 2 one starts a bit late in the life, and it usually affects the elderly group of people. Now, what is diabetes? There is in diabetes we have to talk about the pancreatic gland also. That is, pancreatic gland is secreting insulin. There are different type of cells are there: alpha, beta, gamma. The alpha is producing glucagon and beta is producing insulin. Now, when there is insulin is in the blood, that is the one allowing the glucose to go into the cells for utilization of the cell process, along with some potassium ions. Now, when there is a lack of insulin in the system, only the diabetic features are appearing. Now, in case of this diabetes, we have to talk about this renal threshold for glucose. What is renal threshold for glucose? That is, normal renal threshold for glucose is 180 milligram for 100 ml. So, that means up to 180 milligram per 100 ml, glucose in the renal filtrate will be reabsorbed by the renal system. But so anything above this 180 milligram per 100 ml will appear in the urine, and this will be tested for positive for glucose. Now, in case of elderly people, the renal threshold for glucose is set up to little higher than 180 milligram per 100 ml. That is around 200 milligram per 100 ml. That means up to 200 milligram per 100 ml, glucose in the filtrate will be reabsorbed by the system, renal system, and it won't be appeared in the urine. Now, what are the eye problems in the due to diabetes? Now, when we talk about the eye involvement, we have to talk about some terms. The background diabetic retinopathy. What is background diabetic retinopathy? Background diabetic retinopathy is a situation where we see by retinal examination there will be blood and dead hemorrhages, microaneurysms, retinal hemorrhage, and there are some X-rays. Now, there's another term called diabetic maculopathy, where what happens is, in addition to the background diabetic retinopathy changes, there will be macular edema also. Now, according to the early treatment diabetic retinopathy study, that ETDRS, these diabetic changes are divided into pre-proliferative or non-proliferative type and the proliferative type. Now, non-proliferative type is divided into three subdivisions. One is mild form, mild to severe form, and more than severe form. Now, in case of this mild form, what we see is the features of the background diabetic retinopathy changes. Those are the blood and dead hemorrhages, microaneurysm, exudates, and all that. Now, in case of the moderate to severe, what we see is the pre-proliferative diabetic retinopathy changes. That is the venous changes, venous dilatation, venous bleeding, and some hemorrhages and exudates. Now, coming to the more than severe form, there is a rule called 4-to-1 rule. That is, 4 quadrants of the retina there will be retinal hemorrhage, 2 quadrants there are venous changes, and 1 quadrant there is ERMA. What is ERMA? That is intraretinal microangiopathy. Now, coming to the proliferative type of diabetic retinopathy, there what you see is half of the disc is covered by the NVD, neovascularized disc, or else 1/3 of the disc is covered by the NVD with some vitreous hemorrhage. Now, how are you going to address this problem? Now, first of all, according to the blood level of glucose, we have to treat the diabetes medically. Then, coming to the eye involvement, according to the situation. In case of non-proliferative diabetic retinopathy changes with indications, we can use it by treating with lasers, organ lasers. And in the case of proliferative diabetic retinopathy, we have to do some surgical management to remove the vitreous hemorrhage or else to address to the new vessels in the disc. There are different techniques are there, procedures are there, like what you call this DPP, that is transpupillary posterior vitrectomy, and other procedures will be addressed to this situation.